there's a lot of attention on the global south and the lack of progress on the critical sustainable development goals, reaching those goals, especially on infant mortality and maternal health. Talk to me about that with your work in Africa in particular. Why has progress been so slow? What more can the world do?
Well, thanks for having me. And, you know, I think one of the things we have to realize coming out of COVID is that the wealthier countries could invest in their health systems and invest in their people and rebuild. But these were already fragile health systems across the continent of Africa. And so COVID really ravaged those systems. And if a government had a lot of debt, which many of them did, they couldn't rebuild the health system. And so really saying, how do we help these countries rebuild the health system? Because they have an unbelievable opportunity. There are youth who are growing up in these countries, and I see when they get educated what businesses they're creating and the vibrancy that's there. But we do have to help them get on a path because that debt is not sustainable.
And you've made improving maternal health a passion, a critical goal. Talk to me about that mission and why it's so important to have healthy women and healthy children growing into healthy women.
Well, first of all, 800 moms dying in childbirth every single day. That's one every 2 minutes. Those are needless deaths. Those are deaths we actually know how to prevent and can prevent. And the saddest thing is if you lose a mom in childbirth, that child's chance at 1 year old of growing up healthy is only 37%. So you have devastated the family right there, both with the grief, but also the outcomes for their health and their economic well-being going forward.
One of the things that I saw when I was in Chad with Ambassador Linda Thomas-Greenfield were the refugees coming from the civil war that's erupted again in Darfur, in West Darfur, in Sudan. And they're coming, the children are not vaccinated. No one is vaccinated. The children, the toddlers, the infants are stunted their growth because they can't take in nutrition, and the moms are starving. They can't nurse. And, you know, where do you start? They have now 400,000 refugees just coming since April when the fighting erupted into Chad, and 600,000 others going into Mali and other surrounding countries.
Well, I think you're bringing up a really good point. I mean, anywhere there's conflict or war-torn country, you start to see these devastating health and economic effects. And so where you start is as soon as those refugees come into another country, you make sure that the moms and the babies are fed and the children. You start revaccinating. You start giving them economic opportunity. There are partners who are doing that work. I just met one as a goalkeeper who's here at our event, who is literally helping people get skills online and connect them to jobs. She's a refugee herself. And I think one of the important things to say, though, across the continent, when you look at the whole continent and all the countries, is the opportunities that are there. If we help those governments invest in their health system and their education system, the opportunities for people to live where they are and create economic well-being, you won't see them get up and migrate. You'll see less conflict because people can live more peacefully because they have enough to eat. And that's why investments are so important.
And here in the U.S., the CDC estimates that the death rate in childbirth for Black women is 2.6 times higher than for white women. How is that acceptable in 2023 in the United States of America?
It is not acceptable. It's an outrage. Because of the inequality in our system and the bias in our system, the fact that we are not caring well for those women, this came home to roost for me about 5 or 6 years ago when I read an article that Serena Williams almost lost her life in childbirth in our system. Now, this is one of our top athletes in the world, and she wasn't listened to in our own healthcare system. So we need to fix that because we don't want any mom to die. No mom should die in our country, anywhere in the world, but certainly in our country.
And talk to me about women leadership, because you're such an example of that, of a woman taking hold of these issues that are not funded properly, that are not expressed publicly, and using your platform and doing something about it. And in my own profession, I've seen such an evolution of women in journalism. What can we do to have more women leaders? Because in my own experience, women work collegially. Women in the Senate have worked collegially across the aisles in ways that often men don't.
And women have a different lens on society just because of where we've come from, right? Or people of color. And it's when you see women in positions of power, whether they're in parliaments or legislatures, they make different policy. When you see women in the news, they are bringing a different perspective. They're presenting a different perspective that let Americans decide what they think, right? So I believe women should be in all places, and that means they should be able to make decisions in their home, in their community. They should control resources. They should shape policy and perspectives. And when you do that, even in the home, you start to see, we have good data now, you start to see the children are healthier and the family becomes wealthier. And so I think we're at a point where you're seeing female leadership. We're not seeing enough of it yet. We're getting there, but we need to see it enormous momentum, because guess what? I also believe you would have less war-torn and conflict-ridden places.